My name is Dr. Ronak Patel, and I'm a board-certified orthopedic surgeon specializing in knee and shoulder injuries in patients of all ages. I specialize particularly in complex knee disorders, and because of that, I get patients coming in to see me from all over the world regarding knee injuries, including meniscus tears. Many times patients have a meniscus tear that was treated with a resection and don't have much meniscus left, or they had a meniscus tear that was repaired but did not heal, and subsequently they don't have viable meniscus tissue left. Patients under the age of 40 with a deficient meniscus, whether it's the medial or lateral meniscus, are increasingly prone to getting arthritis. It's not a matter of if, it's a matter of when. Many of those patients would benefit from some new meniscal tissue, and we specialize in meniscus transplantation. In meniscus transplantation, we are taking a size and age-matched donor meniscus from a person who's passed away. The meniscus tissue, or allograft is how we call it, has been processed and cleaned and made sure that it's safe for transplantation. Once the appropriately sized and matched allograft is available, we then perform an arthroscopic assisted surgery in which we're placing the new meniscus into the patient's knee and suturing it around so that it's stable. This involves repairing the meniscus to the surrounding capsule. The surgery lasts roughly about 2 hours, and then the patient is able to go home the same day. The patient is usually non-weight bearing for about 6 weeks and then does physical therapy for about 6 months. We expect full return to activity between the 6 and 12-month mark. If you have a knee that is suffering from a deficient meniscus, or you had meniscus surgery and are still having pain, please do not hesitate to reach out to us and see if you're a candidate for meniscus allograft transplantation. I look forward to helping you get back to the way you want to be.